Welcome to the video. This is Dr. Long with Midwest Low Vision, and today we'll take a tour of Midwest Low Vision, located at our main office inside of Long Family Eye Care in Bloomington, Indiana. We are just south of downtown Bloomington at 660 South College Avenue. Hey, it's Dr. Long, and I'm getting ready to go in to the office here, and today's video is what to expect when coming to Midwest Low Vision for a low vision appointment here at our main office inside Long Family Eye Care in Bloomington. So come along with me as we go through the office for your appointment. Hello, I'm Mr. Smith.
Okay, are you here for your low vision appointment?
I am.
Okay, I just have one paper for you to fill out. I can help you fill it out, and then we'll get you called back.
All right, sounds great. Thank you.
Thank you. Mr. Smith,
Yeah.
ready?
Yeah.
You come on back with me.
All right. Unless we need a visual field test, the only preliminary test that we run is an autorefraction to get an estimate of a patient's prescription beforehand. In the room, we'll also usually do a retinoscopy test that gives us another way that we can estimate what the proper glasses prescription should be. Once the patient is seated in our special low vision exam lane, I will come in and measure the vision using special charts. I will measure for any glasses prescription using advanced refraction techniques. After also considering what's on the patient's wish list and then examining for special lighting and contrast considerations, we jump in and we try special glasses and other techniques to improve the patient's vision for whatever is on their wish list. We'll use glasses such as you'll see here that have telescopic lenses built in, microscopic lenses, special bifocals, bioptic telescopes, reading telescopes, full diameter telescopes, glasses called E-scoops, segmented prism glasses and other types of prismatic glasses, filters such as Enchroma low vision series lenses. At some point during the exam, we need to move to another area to allow patients to see outside and at other distances, but also to allow them to see electronic and other types of video magnification devices, and even just handheld magnifiers, among other things. An experienced low vision technician, in this case Casey, who's been doing this for 12 years, will help the patient with measurements, other demonstrations, and then escort the patient to the front. So that's it. Once the measurements are taken and the order is placed, the patient needs to check out, and we'll call them when their items arrive and set up an appointment for the dispensing.